Hello, my name is Dr Karen-Ann Clarke, and in today's recorded lecture, I would like to discuss a phenomenon that is all too familiar to people who live with mental illness. It's time for us to talk about stigma. Now, stigma is a form of social bias in which we make unconscious, uninformed, and negative attitudes towards those with mental illness. In addition to cognitions, stigma also incorporates an emotional response, and both of these result in the perception being that someone is flawed, undesirable, or threatening because of their mental health experience. It is not limited to developing countries. Indeed, it is found in every culture around the world. Stigma comes in many shapes and sizes. It can be overt and very evident, yet it can also be extremely subtle and highly nuanced. It's very common. It operates at structural, interpersonal, and intrapersonal levels. Its impact on people's lives is serious, and it can lead to fatal outcomes. Now, stigma develops from our unconscious social bias. We all have a social bias. It's the way that our brain organises the barrage of information that bombards our brains at any given moment about the world we live in and the people within it. We make unconscious judgments and assumptions about people that relate to their race, their culture, their age, gender, and size. Our social bias usually favours people who we perceive as being like us, and we often make negative stereotypical assumptions towards people who we see as being very different from us. Now, stigma contains three unique problems. Firstly, there is a lack of mental health knowledge, specifically around the signs and symptoms of different mental illnesses. This knowledge deficit means that we're often not well versed in understanding the ways that different disorders can manifest and express themselves, nor the available treatments and the likelihood for recovery. So as a result, we think about people with mental illness in very different ways to how we think about people without mental illness. And this is more commonly known as prejudice. Now, when our attitudes become prejudicial, we tend to treat people with mental illness differently to others. And this is known as discrimination. Prejudicial attitudes and discriminatory behaviours may be expressed by just about anyone: members of the general public, people in positions of power, employers and colleagues, members of the media, teachers, health and mental health services, family, friends and intimate partners. The list goes on. Now, what these attitudes and behaviours do is both overtly and covertly express the notion that people with mental illness are of less value to society and to themselves. People experience stigma in a range of ways. They may directly experience the stigma and discrimination expressed to them from others. Often, though, they sit in anxious anticipation, expecting to be treated in the stigmatising ways that they've experienced before. This often leads them to withdraw from a range of life opportunities for fear of being subjected to it again. And it's not just the person with the mental illness who feels the effects of stigma. Family members experience associative stigma, stigma that's directed at anybody who associates with the person with mental illness. And the contagion theory uses the analogy of contagious infection to explain why families may be isolated and excluded from within their own communities. Personally, I like the lasagna analogy to explain this situation. You know, when somebody in your community is struck with a sudden illness or an accident, it's common for neighbours to bring casseroles or lasagna, anything that can be heated up quickly for dinner, to help the affected family during the crisis. Well, it's far less common to have a lasagna cooked for you after a family member has had a significant mental health crisis and has ended up in hospital under mental health legislation. Again, people tend to withdraw from families affected by mental illness, almost from fear of catching whatever illness has occurred. Associative stigma is also felt by mental health professionals, and indeed anybody who works routinely with people who experience mental illness. There are a couple of ways that this is expressed. Firstly, there's the perception that mental health nursing is not as highly skilled as other specialties, such as emergency or intensive care nursing. As an educator of nursing students, I frequently hear stories from students who identify a desire to work in mental health services, and they tell me that they've been advised to select another area for their graduate program because they don't want to lose those newly developed skills. And if I had $1 for every time somebody has said to me, "Oh, you must be a very special person to look after those people," I would have long retired from the profession. This is one of the subtle natures of stigma. So in order to understand the magnitude of stigma and in order to give a voice to people who've been affected by it, longitudinal research was undertaken by Melbourne University and Sane Australia, Australia's largest anti-stigma campaign. And it was published as the Our Turn to Speak survey and the National Stigma Report Card. The research involved Australian adults between the ages of 16 and 84 years who lived with the diagnosis of either schizophrenia, bipolar disorder, major depression, obsessive compulsive disorder, post-traumatic stress disorder, borderline personality disorder, and eating disorders. People were interviewed at 2 different time points, 2 years apart, and were asked to identify the top 3 areas of life that had been affected by stigma in the preceding 12 months. The research findings demonstrated that Australians with complex mental health issues are commonly subjected to pervasive, unrelenting stigma and discrimination in daily life. Now, the image on your screen now comes from the National Report Card into Stigma and outlines the real-world domains in which people experience prejudice and discrimination. For the next few minutes, we're going to take a deeper look at how stigma is routinely expressed and felt. Now, this research is really important. For the very first time, qualitative research has revealed the true nature of the phenomenon by giving a voice to people and capturing their stories. Now, you can read this report in its entirety after this lecture, but for now, I'll briefly discuss the top 5 domains that are reported most frequently by people. Now, the area of relationships was the domain in which over 95% of people said that they had experienced stigma. Many people described being treated unfairly when making new friends or trying to maintain existing friendships. 2/3 of people felt the effects of stigma as they attempted to date or maintain their intimate relationships. Over half of the people in the research described rejection or estrangement from their family, and almost 60% said that they were treated unfairly in their roles as a parent or caregiver of a child. As one person from Western Australia commented, "Having my illness dismissed, ignored, unaccommodated for, and being avoided by potential friends is a constant reality for me." As a result of this stigma, almost 90% of people in the research have either stopped making or keeping friendships and have withdrawn from previous friendships. Almost 3/4 have stopped dating or have withdrawn from intimate partner relationships and other family relationships. And sadly, almost 1/3 of people have stopped themselves from beginning a family. So, what are the ramifications here and why is this such a serious issue? Well, if the recent COVID-19 global pandemic has taught us anything, it's that social connections matter a lot. And the lack of social support and loving relationships is a risk factor in both the development of new emerging mental illness and the relapse of existing disorders. Employment was the next domain in which stigma was felt for people, which is not surprising given that Australia has some of the lowest rates of employment with people with a chronic disability in the developed world. The research findings suggested that over 75% of people felt that they had been treated unfairly in their workplace by their employer or colleagues, which also included denial of employment opportunities or flexible work arrangements. Almost 40% have been denied the right to take legitimate leave for their condition. Another participant from Western Australia told the researchers, "I got asked why I needed to take sick leave. I told them that I was unwell. The manager kept pushing me to talk. So I told him I had to see a psychiatrist. And the next day I was fired from my job as it was unsafe to have an unstable employee working with the team." The third domain in which stigma was felt was mainstream healthcare services. These were often described as places in which stigmatising attitudes and behaviours were commonly encountered by people with mental illness. And an alarming 84% of people felt that they had been treated unfairly when trying to get help for their physical health concerns that had nothing to do with their mental illness. Their stories included the experience of being denied help for physical issues, being prematurely discharged from hospital and the emergency department, and being excluded from having a say in decisions made about their physical healthcare and treatment planning. All disciplines appeared to be at risk of providing this form of stigmatising care, including general practitioners, nurses, emergency department staff, paramedics, pharmacists, and dentists. Over 70% of people said that they have received inappropriate or inadequate physical health care. There's a name for this: diagnostic overshadowing. This is the phenomenon that occurs when healthcare professionals view a person's legitimate physical symptoms through the lens of their mental illness. People with mental illness have complex comorbidities and they experience high rates of cardiovascular, respiratory, and metabolic disorders, and their life expectancy is up to 20 years less than somebody without mental illness. Diagnostic overshadowing can have disastrous patient outcomes. And in my 30 years of clinical practice, I have personally observed gallstones, gastric bleeds, and brain tumours misdiagnosed as manifestations of a primary mental illness. One research participant from Victoria said, "Because of my mental health diagnosis, I almost died from sepsis due to a bowel perforation, and I couldn't get anyone to take my symptoms seriously." As a result of these experiences, 80% of people said they no longer try to access physical health care, and almost half have said that they stopped obtaining scripts or taking medicines for their physical health conditions. 50% no longer attend their physical health screenings for things like vaccinations, dental care, breast or prostate screening. And alarmingly, 1 in 2 people have stopped calling 000 for an ambulance or for attending hospital for emergency treatment of physical health problems. Stigma encountered through social media was the fourth domain identified in the research. The use of social media platforms provides both positive and negative outcomes related to stigma. Social media has enabled people with complex mental health needs to connect and share their experiences with peers and the general public at large, and to advocate for themselves. The reality for over 95% of people in the research was the perception that social media portrayed mental illness unfairly, leading people to feel offended or hurt by the common portrayals of violence, of hopelessness at ever getting well, or being blamed for their illness in the first place. 6 out of 10 people had been bullied online or blocked from accessing certain forums or sites. As a result, people said they stopped sharing or posting their experiences in life. Now, whilst this could be seen to be protective, it also prevents the online support that comes with connecting with others who have similar experiences. One participant in Victoria spoke of the experience saying, "People are awful. I wrote about how I'd tried to take my life and was absolutely attacked by trolls who commented sarcastically and extremely hurtfully. It's not safe to express yourself on social media, not at all. People's stories of the positive benefits of social media use were highlighted in the research, and many people appreciate the ease with which they could connect with support groups and, in particular, mental health organisations. This allowed them to feel less isolated, more able to obtain information and support, and to increase awareness. The research also highlighted some mixed reactions to the effectiveness of social media in reducing stigma. One person from Queensland commented, "There are a lot of supportive posts and memes on social media, and I'm grateful for that. But there's also a lot of what I call positive shaming. By telling people with mental ill health they just need to be positive, etc., it actually shames and further stigmatizes." Now, although it would seem reasonable to assume that mental health services would be less inclined to endorse any form of stigmatizing behaviour, for the people in the research, this was not the case. And this was the fifth domain identified. In fact, almost 3 out of 4 people with mental health disorders experience significant stigma from staff within mental health services. People with the diagnosis of treatment-resistant depression, bipolar disorder, trauma-related disorders, eating disorders, and personality disorders reported stigma. Now, these are disorders that occur more commonly in women, so it's not surprising that over 80% of the women in the research spoke deeply of these experiences as they sought help for their mental health. Just like in mainstream healthcare settings, people felt they were treated unfairly, denied help, and 1 in 2 people felt excluded from participating in their own care planning. A person from Victoria described this denial of help very clearly, saying, "I have been denied services at the emergency room because of my borderline personality disorder. I've been told that I will always feel suicidal, it's chronic, and I should learn how to live with it. I was denied admission to the emergency room despite saying I was extremely suicidal, was unsafe to go home, and I would hurt myself if I went home." The most alarming finding from the research demonstrated that 1/3 of people fully expected to be unfairly hospitalised, restrained, and/or secluded in the future when they sought help. Given the fact that significant numbers of people who seek mental health care come from traumatised background, this expectation is grounded in a fear of re-traumatisation. Many mental health services operate in a trauma-informed way that creates a safe and trustworthy space in which collaboration and choice allows people to feel empowered to make decisions about their care. However, all of this can be completely undone when expressions of stigma are felt by the people receiving help. The most harmful type of stigma is self-stigma. When people with mental illness endorse the community's harmful, negative, and inaccurate stereotypes and begin to feel less valued, they experience less sense of self-worth and they fear rejection. A form of self-fulfilling prophecy occurs. They begin to see what they believe. So as a result, people with self-stigma become isolated and socially withdrawn. They avoid employment opportunities. They have fewer friends and supports. More importantly, they are less likely to seek treatment. They're less likely to adhere with treatment, and they experience higher rates of distress. These conditions lay the foundation for the exceptionally high rates of mortality and morbidity associated with mental illness. So what can we do to change the expression of stigma, to reduce the harmful effects on people's lives? The National Report Card on Stigma was accompanied by a ream of recommendations in an additional report. In relation to the specific domains I've discussed today, the report suggests that to reduce the impact on relationships Access to evidence-based psychosocial programs, discussion groups, and events that build meaningful connections should be expanded. This would allow for the development of positive relationships and for the development and use of communication skills to reduce self-stigma and isolation. Evidence-based psychoeducation programs and respite options for carers, including young carers, are also needed to help build their capacity to support their loved ones. To improve the impact of stigma within the workplace, the recommendations of the report card align closely with those of the National Workplace Initiative, an Australian federal government project that provides a nationally consistent approach to workplace mental health. They recommend that approaches to mental health in the workplace must respond to complex mental health issues by promoting reasonable adjustments, flexibility, safe disclosure, unconscious bias training, and mental health first aid. People with complex mental health needs should be more visible in the workplace, and there should be a valuing of their lived experience. Finally, there should be an increase in funding for programs that support people affected by complex mental health issues. Their strengths and employment goals should be clearly identified, with the option to access support as required during their employment. Mainstream healthcare settings require educational opportunities and trauma-informed care training that are informed by people with a lived experience of mental illness. Education must be used to raise mental health literacy to the levels of physical health literacy in all clinicians. Additionally, routine physical health screening should be made available within mental health care settings in order to improve the health of people with complex mental health needs. For the problems of stigma occurring within social media platforms, the report recommends developing a widespread social media campaign that uses positive stories of recovery and hope, using people with the lived experience of complex mental health needs. A resource that highlights the stigmatizing use of language could also be adopted. Social media platforms could also consider selected safety by design principles to include a reporting function that allows people affected by complex mental health issues to report stigmatizing behavior on sites and forums. And finally, to address the problems of stigma in mental health settings, embedding educational programs into mandatory education for clinicians and increasing the uptake of advanced health directives may reduce the expression of stigma and encourage shared decision-making with the person who has complex mental health needs. There were significant comparisons made between the public and private sectors, where people described easier access to care and a more therapeutic environment. Funds are therefore needed to support coordination of care and mental health system navigation specific to the needs of people affected by complex mental health issues. Other research has consistently argued that the most effective ways of reducing stigma are found in education and contact, much of which has been supported by the findings of the report card. Education, which has a focus on the recognition of disorders, the factors that contribute to the development of the disorder, and available treatment options, are effective strategies. Attending conferences and seminars is another powerful way of improving your mental health literacy, and companies like Ausmed have many different resources with a focus on mental health in both the face-to-face and the online spaces. So, to summarise, stigma refers to harmful, negative, stereotypical assumptions that are made about people with mental illness. It can be overt or subtle and nuanced. Australian research has demonstrated that it's a pervasive and unrelenting occurrence, especially in relationships, employment, social media, and general and mental health care settings. Education and personal contact can be an effective strategy to reduce stigma. I would like to leave you with one simple message. People with mental illness want exactly the same things as you and me. They want a home, somewhere safe and decent to live, They want a job or something meaningful to occupy their daily lives, a reason to get up in the morning. And finally, they want a life worth living, something to share with people they like and love, and which gives them hope for the future.